Low-dose naltrexone is a medication that is often prescribed in patients who have conditions like chronic fatigue syndrome and long COVID. So in this video, I'm going to explain a little bit about what low-dose naltrexone is and why it is thought to work. So naltrexone in its original formulation, so not being the low-dose naltrexone, so at doses of 50 to 100 milligrams, is an opioid blocker. So opioids are medications such as morphine, OxyContin, oxycodone, Palexia. Heroin is obviously a drug of abuse but is from the morphine family. So naltrexone is used to treat opioid addiction, and it does this by blocking the opioid receptors. However, when it's used in the low dose formulation, it has completely different mechanisms of action. It is thought it may have a low level of opioid blockade that isn't thought to be that significant, and if anything, it can increase the activity at the opioid receptors. But that isn't the reason that it's given in conditions like chronic fatigue syndrome and long COVID. It's also thought to modulate the immune system through its action on glial cells. So glial cells are cells within the nervous system that are involved in the response to inflammation. So by blocking some of the glial cells, the low-dose naltrexone is thought to be anti-inflammatory. So it has many advantages as a medication. It is low dose, so its dose is 3 to 4.5 milligrams once a day. It can be as low as 1 milligram and it can be as high as 12 milligrams. It tends to be low risk. The most commonly reported side effects are things like headaches. Some people get vivid dreams. There can be a slight increased risk of nausea and vomiting. And in some people it does increase fatigue levels. It also is low cost, which is another positive on the medication. And it doesn't tend to have any withdrawal side effects. So if you decide to come off it, that's absolutely fine. One of the things about it is though that the results aren't consistent in terms of how people respond to the treatment. So both completely life-changing effects and complete symptom resolution has been reported, and absolutely no effect on symptoms has also been reported. So that can make it challenging in terms of using it as a treatment, because you can't really give a patient a guarantee that it's going to definitely have a positive impact upon their symptoms. In terms of disadvantages, there are a few. The main one is really that it hasn't been studied very well. So a lot of the mechanism of action is more postulated than actually proven. Also, there isn't a lot of long-term safety data on it. And again, this is because a lot of its evidence comes from really small clinical trials or just case studies of 1 or 2 patients. Having said that though, it has been around for a very long time, and it doesn't appear that there are any particular safety concerns emerging. A challenge when it comes to using low-dose naltrexone in a condition like long COVID is that it has not been established which patients are most likely to benefit from it. It is thought that perhaps the patients who have a greater overlap with the symptoms of chronic fatigue syndrome may benefit the most. So that being symptoms like fatigue, poor unrefreshing sleep, post-exertional malaise, brain fog. If your symptoms are prominently those kinds of symptoms, then you may benefit from it. And it is thought that patients who have more like a POTS presentation, so being upright being the main trigger of symptoms, and symptoms like palpitations, dizziness, lightheadedness, if they're your most prominent symptoms, then low-dose naltrexone may not help that much. However, we all are aware that patients can have lots of different symptoms and there can be an overlap. So it may be worth trying regardless, but it is useful maybe to know that if you have more of the POTS kind of presentation, you may not get all that much benefit from low-dose naltrexone. The reason it's used in conditions like long COVID and chronic fatigue syndrome is that it is thought that both of these conditions reflect an underlying low-grade chronic inflammation. So the fact that low-dose naltrexone has some potential anti-inflammatory effects and is low risk and low cost means that it may be a good option because if helped, that will be great. So my take on low dose naltrexone is that it is low risk and it is low cost and that it could be tried, but the patient who is trying it should be aware that the symptoms may not significantly improve. And, you know, if that happens, you can just come off it and you won't have to be worried about any after effects. Like all the medications used to treat these conditions, they are symptomatic. So if it gives any level of symptomatic improvement that allows you to engage in more physical activity, then it is probably worth giving it a try.